As 2019 came to an end, most athletes in the world of sport were enjoying their final major break before the Tokyo Games. Meanwhile, the doctors at the English Institute of Sport started to hear reports of a new virus affecting parts of the East Asian continent and starting to affect Europe.
By March, it was quite clear that, particularly in northern Italy, death rates in, as it were, a first world country with quite high densities of populations were quite significant. And it was actually very scary. We genuinely wanted to ring alarm bells with UK Sport and with the high performance system saying, this may have a significant impact on us, and I think we're actually going to have to think about closing down centres.
The 3 months between March and June 2020 were characterised by 3 key themes: stay safe, keep connected, and get creative. Luckily, these are mindsets that are embedded strongly into the culture of the EIS.
I think the first thing is you have to very quickly adapt. It probably came at us quite quickly back in March. So we very quickly reprioritised from a focus obviously about going into Tokyo and how we support the practitioners and the sports we work with to do that, to one to how do we really step into the unknown. We also had a real big focus, particularly early on, is on people, checking in with people, seeing how they are. And our disciplines came together and connected, providing athlete support at a distance. So how could we do that across disciplines, across professions? As 2 months of lockdown, we went from having nothing planned, literally nothing, to delivering 150 learning events over 2 months, all online. To be able to collectively do that was almost a real mammoth effort from a standing start. Our psychologists, our lifestyle advisors, our mental health team came together and started to look at how we best help people cope with and adapt to a constantly changing situation.
Keeping connected, our communication across the organisation, bottom up, top down and across the organisation has been absolutely one of the key strands that we have concentrated on, and getting creative. So in other words, what we were doing before may not be possible, it may not be appropriate, but how can we continue to provide the services that we are funded for in a different way? We've got a few people who have volunteered, whether they be doctors or whether they're physiotherapists, because they've got the training in their local community. That's one way we've given back. And that would probably be the biggest example of how we've contributed. Our physiotherapists, our psychologists, our doctors in particular.
We've been the go-to people when it's been to give advice. The dialogue was started up, invited by the Department of Culture, Media and Sport and hosted by UK Sport through Sally Mundy, of a panel of doctors and other associated sport providers to try and look at a staged process, 5 stages, whereby sport could start off again.
All along from day one, it all has all been about the individual members of staff and making sure that they're confident that the EIS is doing everything in its power to ensure that they're returning to an environment that is safe and conducive for them to be working in.
I hope that we've added value to the system to help Olympic and Paralympic sport move forward in this very difficult time.